Can psychological problems present with disabling physical symptoms? The answer is yes. I will illustrate with a case history which of a patient whom I had recently managed. So it was a 25-year-old woman. She was doing post graduation in a reputed university. She was doing very well in her studies, and everything was going on well until about say 6 months back. And when she reported the weakness of both the legs, and this resulted in difficulty in walking. She had difficulty in walking, climbing stairs. Also, when she sat down, she had difficulty in getting up, and she reported this to her parents. And so, for which she was evaluated initially by general practitioner, and then subsequently also by a neurologist. And when they examined, they could not find any specific problem. So further investigations were done, including blood tests, EMG, nerve conductions, and even MRI, and all reports gave as normal. So doctors had no clue at that time. They were trying their best to find the diagnosis, but since all the tests were normal, but on the other hand, the patient's condition kept on deteriorating. So by fourth month into the illness, she required some kind of support to walk, and by the fifth month into the illness, she could barely walk, and she required a wheelchair for mobilization. So it had resulted in severe disability, so much so that she required assistance for any movement within the home, or any she could not go outside in any case. And other than weakness, she had no other issues. Her higher functions, including memory, were normal. She could eat, and swallowing was normal. Speech also was normal. She had normal sensations, and that means no numbness. And she had normal bladder and bowel functions. So, at this point of time, one of her parents' friends, they knew me. They requested for second opinion, and then since all the tests were normal and the person was not in the city where I work, so it was interview was done with the patient. I requested for one-to-one conversation with the patient, and on the phone. And then after building up the rapport, what was found is that she had some kind of psychological problems going on. She was in a relationship with a person, a man of another faith, and but the man's parents, they did not approve of this, so it had resulted in a breakup, and all her symptoms had started afterwards. But the patient herself, she has not discussed about her relationship or the breakup with her family members or friends. It was totally private, and she was going through this. So at this point of time, it was clear that we are dealing with a condition what we call functional neurological disorder, where a person has psychological problems, but instead of manifesting as psychological symptoms such as depression or anxiety, it is mainly presenting as physical symptoms. And in her case, it was motor disorder or motor weakness. Now, this functional neurological disorder is not something new. It is not something uncommon. Also, in our OPD and practice routinely, we see patients. But what is important is that we should keep our mind open, and we should explore all the possibilities. Because, as in this case, because the doctors could not find any specific cause, they had labeled her as a case of chronic fatigue syndrome, which was not the reality. And in this case, I suggested to the parents that with that she needs further management with a team of specialists, which should require a neurologist, psychologist, physiotherapist, and occupational therapist. And I was happy to note that later on she showed good improvement, and by 1 month, and then within 3 months she was back to her usual normal state. So the message I would like to give here is that those psychological problems commonly manifest with the psychological symptoms like feeling sad, depressed mood, and other symptoms, anxiety, sleeplessness. But in some cases, the psychological symptoms may be absent or may be very mild, and the physical symptoms may be more dominant, like in this case. So physical symptoms can be weakness, as in this case, or sometimes it can be something mimicking like convulsions or seizures, sometimes movement disorders, and sometimes numbness. So many others, sometimes just hyperventilation or rapid breathing. So many of these symptoms can occur. So once we examine carefully, there are also positive signs which a doctor can pick up. And for the doctors, junior doctors, my message is that always keep this possibility in mind, because treatment is very rewarding, and patients have a good relief of symptoms if we correctly diagnose and correct treatment is given.